The future of obstetrics and gynecology is changing for the better, especially with the mixing of medical advances and complementary medicine. We spoke with Dr. Lisa-Bodon from Desert Regional Medical Center in Palm Springs, who explains the changes.
I think a lot of women have trouble with heavy periods and needing a hysterectomy and not wanting to do it. You know, people don't want invasive surgery. They don't want the time off work. They don't want 6 weeks of recovery. Some women have heavy periods where they have to stay home from work. They're using a thick maxi pad and they're changing it every hour, every 2 hours, and it's lasting for days. They're feeling shortness of breath, chest pain, lightheadedness, dizzy. They might even need to come into the emergency room and get a blood transfusion because they're bleeding so heavy. Sometimes it's caused by uterine fibroids. Sometimes they just have it. It's just dysfunctional uterine bleeding. I think there's other options now. I mean, there's a laparoscopic supracervical hysterectomy where they go home the same day of the surgery. They have a hysterectomy. They have a tiny little incision in their belly button. They can go back to work in a week. So Gardasil is a vaccine against human papillomavirus. And human papillomavirus, or HPV, is a virus that we know can cause cervical cancer. So the vaccine is offered to women 9 to 26. It's a series of 3 vaccines, and it helps prevent them from getting cervical cancer and genital warts. It's wonderful. I recommend it to everyone. I mean, right now it's approved for women aged 9 to 26. It's a series of 3 vaccines. It's 100% effective. I mean, the studies are wonderful. I tell all the patients that if they're in that age group, they should get it. Their daughters should get it. They should get it early. They have a better immune response to it. Early cervical cancer is difficult to detect. And that's why pap smears are important, because we want to detect it early so we can prevent it. There's relatively new guidelines regarding pap smears, and that is you have your first pap smear by age 21 or 3 years after sexual intercourse. After that, it's every year. If you've had normal pap smears, you're in a monogamous relationship, you can have a pap smear every couple of years. You don't necessarily need it every year. But I think the women that come in with cervical cancer have not been seen by a doctor and have not had a pap smear in years. So the reason to get pap smears is to prevent cervical cancer. It's absolutely treatable if we get it early. Most women that have an abnormal pap smear, if they're young, it takes 18 to 24 months to clear the infection. They can clear it. They don't necessarily need to have surgery or a procedure done if they have an abnormal pap smear. We can follow them closely. Most healthy women that don't smoke can clear an infection. I'm amazed people pay me to do this. I love it. I get up in the middle of the night and deliver a baby, and I think it's the most wonderful miracle I've seen.